Doing it now. All right. Great. Well, welcome to Stress, Trauma, and the Body's Response. Again, this is Beth, Katie from Modern Compassionate Care, and Sarah Rose from Sarah Rose Botanicals. And we are going to just dive right into it. So like I talked about a little bit before, when we are having these conversations about mental health. I'm a therapist. I hear people all the time using lots of words. I use a lot of words in trying to explain different symptoms or experiences people are having. People come in and need a diagnosis. It's required for insurance at times. Some people like to have a diagnosis. Some people that might resonate with them and help them understand what their symptoms or experiences have been like. Sometimes that's very stigmatizing. Some folks don't recognize that they may have experienced trauma in their development and upbringing, or in a relationship, or as a chronic experience, because it's not that bad, right? We have really for quite a long time thought about trauma in very significant, often singular events, car accidents, being at war, severe examples of abuse. But as we are understanding the constellation of symptoms that you might find in the diagnostic manual, we are recognizing to a greater extent that there is a lot of overlap, and not just in the diagnostic manual of mental health disorders, but also physical symptoms that people have, physical diseases that people are diagnosed with can have origins in trauma experiences, chronic exposure to stress, and it can manifest in anxiety. So I just wanted to include this to really kind of talk about the idea that there are all these terms that we use a lot: stress, trauma, anxiety, panic attacks, sleeplessness, substance use, nervous system dysregulation is something that we will talk a little bit about today, and has become a more common and popular term for people to understand. And again, that is referencing our central nervous system, our autonomic nervous system, and the way that when stress is coming into our experience, whether it's an external stimulus, whether it's just overwhelm with trying to keep up, whether it's because of the holidays and everything that everyone feels like they have to accomplish, getting back to normal, COVID anxiety, kind of reestablishing what normal is for us after these difficult couple of years. And then often people are at the same time having a lot of physical symptoms. Katie sees a lot of patients with chronic pain, inflammation, other illnesses that are approved by the Illinois Cannabis Medical Card are often related to inflammation. And we have seen that, and Katie will probably speak on this a little bit better than I can, what the connection is and how inflammation can be a result of stress and the chronic exposure to the activation in the nervous system, where we think we are responding to, and I use the word think, but we are physically and mentally, our systems are connected, and we are possibly interpreting incoming stressful stimuli in ways that may or may not be the actual response our body needs to give, or it is causing our system to stay in a period of activation. So for instance, if you are having an argument with a loved one and your nervous system gets dysregulated, your heart pounds, you feel unheard, you're sweating and you're nervous. You are also maybe maybe yelling back and forth or something like that. That's the activation that we're talking about, the physical symptoms that come along. And I know, and we know this, to kind of like focus on these things to help ourselves, downregulate from having that activation. but it is chronic experiences like that and a difficulty of managing those responses in our body that can also lead to mental health disorders and physical health disorders and disease. Go ahead. So I wanted to talk a little bit again about the word trauma and how trauma is something that we are looking at in a more expansive way. Trauma is really any kind of stress that our brain experiences as a threat to our safety, a threat to our connection. We are wired to attach and we are wired for connection. And not only does this happen in these bigger significant experiences like a car accident, where that makes a lot of sense, but also as we're growing up, experiencing trauma in very small and large ways is a part of growing up. It is a part of the developmental process. And as Gabor Mate says in his book that talks a lot about our experience of stress and trauma and how it results in these physical disorders, that trauma is not what happened, it's how our body experienced it. And essentially what kind of lasting impact that has. So from a brain standpoint, our prefrontal cortex quickly is what really makes us human in that we can executive functioning, we can plan, we can logically reason, we try to have empathy, we're responsible for emotional regulation. This is meant to show you, okay, there is a argument with your spouse, but that is, it's not a crisis. It is something that can be worked through if that's functioning well and your relationship is safe. And perhaps you have that emotional regulation working very well for you. The hippocampus, again, these systems all work together, and the hippocampus is really known for memory and learning. While the amygdala is really that lower part of the brain, that animal part of the brain, reptilian part of the brain, sometimes people refer to, this is really your fight flight response. It's responding to threat. It sees a threat. It knows to run. It knows to fight back. It's ready to go. But it is refined with the idea that the prefrontal cortex and the hippocampus say, okay, here's a threat coming in. My daughter has a very strong phobia to dogs. So this is not, but most folks can see, okay, that's a dog, he's barking, but, I know from my memory that most dogs are well trained and, it's going to be okay. And all of those parts of the brain work together to say, like, I'm reasonably safe in this instance. When people have experienced long-term stress or trauma, we can see in MRIs that these brain structures have changed shape. Prefrontal cortex and hippocampus have shrunk in folks with complex post-traumatic stress disorder, which we'll talk about a little bit more, and good old regular post-traumatic stress disorder. Those areas can actually shrink and atrophy when someone's been activated and is in the fear response more often than not. The amygdala can actually increase in size. So it's just kind of giving you like trauma and stress as we experience it are actual injuries to the brain. And it's not something that's just, someone's not strong enough to withstand. It really is changes in neurological functioning. And this is all really important. The reason why we talk about the ANS, or the autonomic nervous system, is that the connection through the nervous system is really defined by these structures connecting to the nervous system and kind of informing the body and also being informed by the body. And again, I'm talking about those physical senses that we don't always notice as much as we should. Pounding heart, sweating, feeling cold from the inside. I could go on and on forever in terms of ways that we know, headache, exhaustion, the ways that we know that we are having a very strong stress response.
I'm just going to chime in and also say tummy troubles,
Yes, thank you. I know there was like having a total, like not thinking exactly. So connected to our gut. Absolutely. A lot of folks experience, these are just a little bit of an expanded look at each of those structures, and we will have these available for you after. This is again from the Institute of Child Psych. Great content. I found these graphics on Instagram. And yes, our brain is directly responding and communicating with our stomachs for the purpose that when we are under threat, we need to stop the body's energy flow from our frontal cortex and to our stomachs, because our brain at the amygdala stage is saying there is something serious going on and we need to attune to that and only that. And that is some of the disruption we experience. And that happens through the connection with the ANS. And so the physical experience kind of feeling like it goes offline, I think is related to that as well. And why you might think the amygdala, if you're exposed to a lot of trauma and stress, is enlarged. This was a really great graphic on the autonomic nervous system. I could do like several hours of training on this. I still need several hours of training on this, but as a functional understanding of how our brain is truly connected to our body, I really love this visual of the nervous system running through the spine, and you could see reaching all the way down through your gut, all the way to your legs. And that our different systems are activated in different ways at different points and for different reasons. And again, when we are experiencing chronic and repeated activation in all these structures, including the brain, including our physical in the stomach, we are dealing with the stress of the chronic, of any of the chronic symptoms that come with it. We're dealing with the stress that we're actually dealing with. And I know we're all working so hard to feel better. And so all of these systems come into play when we are seeking out healing. So I want to talk a little bit too about the presence of PTSD, which I think we all know and understand for the most part as being a disorder that has been come to have been recognized. Again, in the DSM, it is mostly based on like a singular experience. And then we have a lot of practitioners who are recognizing that PTSD is a little bit more complex than just a car accident or a specific assault, that we have probably all experienced some level of trauma or stress in an ongoing way throughout our development that has just helped, or in some ways helped us develop certain attributes and patterns. I think that sense that, like some of the hardest things, make us stronger is not necessarily the idea I'm going for, but that we learn ways to deal with difficult situations and our internal and external experiences from a young age. And that we all attempt to make the adjustments in our and find aspects of our personality to help us figure out how to deal with stress, trauma, difficulties in our relationship with our parents, difficulties in our relationship with our siblings, difficulties in the external factors of how we grew up, where we grew up, medical illnesses, whatever the difficulties have been. These cause kind of a pattern of habits, a pattern of reactions, of responses, of expectations. And the reason complex PTSD, I think, is so interesting is it really can talk about how you might be presenting now when you come to therapy. Well, okay, like you have anxiety, but why do you have anxiety? And you might talk about these interpersonal disturbances. You might talk about a negative self-concept. You might talk about affect dysregulation or the feeling of being upset, noticing that you're feeling afraid, angry, all of those things, your affect, your feeling state, and not really being able to have a good control over that. And again, it's also connected to this sense of threat. possibly avoidance, re-experiencing many of the same things we see when we are talking about just classic PTSD.
Can you talk a little bit about especially the re-experiencing? I know we've talked about this before, but that's not always what people think it looks like. If a lot of times the tests, if you're taking at a doctor or a therapist's office about PTSD, they're asking if you have flashbacks, which I think that's kind of a strange term to use for it, because it kind of gives the idea that you are like hallucinating, you're out of it. And so people are like, well, no, I don't experience that. But like, what could this re-experiencing, or what can a flashback look like for someone?
I think in the experience of complex PTSD, that actually the idea of a flashback, we are having them far more often than anyone understands or acknowledges. And an emotional flashback is one thing that we can discuss further, is that you perhaps grew up in an environment that, let's say that there was abuse or chronic chaos. When you sense that threat and your body has that memory, or your brain is primed to be vigilant or aware of that particular type of threat, maybe that came from a particular caregiver, for instance, and you re-experience that, or you have a similar experience that feels the same from a current partner, or in a job, or even in your friendships, whatever the case may be, you can have an emotional experience, an emotional flashback. So to you, it's not like you're going to have this whole thing where I'm remembering, how my grandmother shamed me for, being myself as a young child, but you might remember, you might have the same experiences of shame, of that physical response in your body, of that protective measures you might have taken as a child, to where you just hid in your room and avoided the situation and, dissociated. And certainly you don't think about dissociating necessarily either. And we can talk about that a little bit more, as how we kind of shut our brains down to what's going on in the current experience. But I agree with you. That's again, like kind of the difference between the classic PTSD and complex PTSD, is this getting away from this idea that it is like this very specific visual like almost a psychosis experience, a very intense experience that you automatically recognize right away. You might be having these flashbacks far more often than you realize, and it's really informing your reactions that might again lead to the interpersonal disturbances and the negative concept on a regular basis.
And just to go even a little further back, Beth gave this great example of a grandparent. We're also now understanding that there's physiological impact, genetic impact from generational trauma. Yes. And so we may also be carrying in our minds, in our bodies, trauma responses from trauma that even our caretakers, maybe our parents or grandparents, didn't experience directly, or maybe something that a grandparent experienced that they never talked about. So there's a lot of layers to this, which can make it confusing. And also, I just offer that up to say that we don't always have to know the source of why something is happening to acknowledge that it's happening for us.
So true, Sarah. I worked in the adoption realm for a long time, and we, had babies that would go home with families, right away. And it was often, why is there, this kind of experience that the children have in development, and really coming to understand that even from in utero, we take from our cellular experiences of our mothers and the experience in utero of stress and trauma. And that is when our autonomic nervous system is developing, right from those cells that you share, and they're growing with the, endocrine, the hormonal response of your birth mother, and that someone who's in a state of chronic stress and trauma, as some of our birth mothers were, would impact a child in the same way, even though they never were able to live together. And that is true too with experiences. There's research about the Holocaust and families that have had that from, multiple generations, that trauma symptoms persist.
Or the same, I'll be sharing an article about post-traumatic slave syndrome, which is that concept was developed by Dr. Joy DeGroy. And that speaks to the same thing, the legacy of people have the family trauma of slavery in their history, and what that has looked like for generations of people now. And that is also a trauma that some people may need to be factoring in when they're examining, the chronic stress that they're under. There may be, layers of that going back in history from, what you've personally experienced to what your ancestors have experienced. And I think it's a very interesting concept. So we'll share that along with our resources.
Absolutely. These are just the kind of a breakdown of the actual response systems. It's almost kind of like the behavioral and thought and emotional reactions that come from the physical activation from stress and threat and trauma. And this can also teach us about ways that we may have developed patterns of protection in response to difficult situations. Again, like with the grandma response, I would identify that as a freeze response, as if you had, learned to just hide from everyone to avoid being shamed or abused. I'm using the term shame because I think a strong understanding in the complex post-traumatic stress disorder framework is that there isn't necessarily outright abuse that happens in the development of some of this. It can be significant emotional neglect. It can be, and again, I think that people have a hard time with the word trauma because it sounds so blaming, like somebody did something to you and that person is wrong, and that doesn't fit with how people feel about their families. But we can also accept that our parents and caregivers were doing the best they could with what they had, and they may themselves have been dealing with trauma responses. They may have been being taught or applauded for parenting styles that resulted in some of these responses. So it's really giving yourself also the permission to understand that despite everyone's best efforts and intentions, negative things happen. That's part of growing up. And sometimes this is the result. And so these are kind of interesting. And there's different combinations you might recognize if you dive a little deeper into the fight response, pretty well-known flight response. Again, that's the amygdala speaking right away to protect you. And the freeze and fawn responses are newer ways of thinking about the way people may avoid conflict. They may turn inward. We might see depression symptoms as a result of the freeze response. And the fawn response is a really interesting one that resonates with a lot of my clients in people pleasing, in trying to be a peacemaker, in trying to make other people feel better about themselves, even if they've done something wrong, to repair that attachment and repair those interpersonal disturbances, even if it's betraying themselves. And that cycle can in and of itself cause ongoing stress.
And I think, I associate that one with a lot of the chronic pain syndromes that we see. A lot of times the patients that I see are stuck in one of those 4 states. And I also think it's important, that you might, those responses, you can have any of those responses depending on different relationships you have, different times in your life. Sometimes people identify with fight response or something, but, depending on different circumstances, you might find yourself reacting differently, and you could be in one of those other states. So
absolutely. There's certainly combinations and different situations that call for different reactions. I am including this book as a really great guide to understanding the idea of complex PTSD. I actually listened to it. I did it for the first time as an Audible, driving my kids all over God's creation. And it's written by the therapist who's very, very honest about his own experience, not only with his own traumatic history in his experience in his family of origin, but how he really healed, how he went from not understanding that he even had a traumatic history to what it takes to really heal, identifying emotional flashbacks and working through them, reparenting the self, silencing the inner critic. We can talk more about this, and I think we all will talk a little bit more about how we heal ourselves from this chronic stress, activation and exposure. But this book has been incredibly, it's been a real turning point for me in understanding not only my clients, but myself, and really helps me understand the folks that I'm interacting with on a regular basis, whether they're in my family or other families, and different interpersonal relationships I have, that really providing empathy, that we are often in a response of self-protection when we're faced with threat and chronic stress. So that's all of that. I'd like to see everyone's faces again anyway.
Okay, let me,
Thanks, Katie.
wait, how do I stop sharing the big button?
There you go.
Okay.
Thank you, Beth. Those slides were really digestible on a
Okay, well,
hard to
yeah.
digest topic.
And
In my opinion, if anybody else thought they weren't digestible, please feel free to give us feedback on that, because you and your experience is important to us.
yeah, so again, when I do work with my clients, often coming in with the basics, I'm procrastinating. I cannot focus on my work. I don't like being on Zoom all the time. This isn't what I was signed up for, and I feel just completely ambivalent, having interpersonal issues at home. And inevitably, we can kind of trace back the cycles, the responses, the chronic stress. And again, it isn't just the mental health stuff, which is again my focus, but the physical experiences that people have too. When we did see Gabor Mate give a speech on the health implications of chronic stress, he had I don't have the exact statistics, but something like a four times more diagnosis of MS more often in women, and inflammation diseases, like how they have proliferated autoimmune reactions, and that
In the past, like 40 years, I think,
Right.
I mean, we'll continue to talk about that book for next time too. The Myth of Normal, Gabor Mate.
yes. But that there's that, and as a physician for many years, recognizing the environmental stressors and the interpersonal stressors as being something that doctors are never talking about, or I shouldn't say that, but are not trained and not routinely, in my own experience and in his research, assessing for trauma, stress in more than kind of a cursory sort of way.
And I mean, I really think that, especially with the type of patients that I see, specializing in medical cannabis, I see a lot of chronic pain patients, for example. And I really would say it would be, I don't know of any patients that have a chronic pain syndrome that aren't also suffering from some mental health symptoms, depression and anxiety. Not only, just the strain of being in pain and dealing with that, but they also share the same, kind of inflammatory signature, in the brain and in the nervous system. A lot of these pain syndromes, it makes complete sense why, in addition to just mental strain, this sort of physical stress that's occurring in the body with pain results in depression and anxiety organically in the brain. Like, that's kind of what I'm seeing. And it's interesting because, with cannabis, because it works in many different ways in the body, as we kind of talked, it can be really helpful for many things when it comes to PTSD, right? Like I have a lot of patients who have the diagnosis of PTSD, and they have wide-ranging symptoms, things like sleep disturbance. As Beth talked about, the autonomic nervous system, the hippocampus, the center of memory and learning, impacted in people with trauma. Well, cannabis can sometimes be helpful for people with trauma to produce like a dreamless sleep, or someone who has recurring negative dreams, waking up, in a panic, in a sweat. Cannabis, because of the way it works in the brain, it can help in trauma. There's even been some cool studies in traumatic situations. Someone that was administered cannabis right after the traumatic situation, it prevents those traumatic memories from forming. So this is a circumstance where forgetting is protection. Then again, there's a fine line there, because we also talked about dissociation being kind of a hallmark of complex PTSD. And when someone's using cannabis to treat PTSD, you're walking that fine line between, reducing those traumatic memories, but you also don't want to be dissociated all the time. And I don't, I always think about what our, mentor and now friend, Dr. Dustin Sulak, uses this analogy of a crutch and a tonic when it comes to cannabis. That it can play different roles. And when you are actually, you have a broken leg and you're using a crutch, there is a good long portion of your healing that you need that crutch to be able to get around. But the very end of the healing process is when you actually bear weight and the bone is able to finally fully stitch back together with the weight bearing part of it. So a lot of the work that I do is kind of helping someone move from, if they are using cannabis as a means for just dissociation, and that's starting to impact their life, which it's something I've seen. It's very common that people get relief from PTSD symptoms with cannabis. But I definitely think these are patients that deserve special support, because there are ways to use it, including, using CBD as part of your regimen as a way to increase your endocannabinoid tone, like we talked about last time. There's strategies that can help you use cannabis more like a tonic, a health tonic, something that's helping you with your goals of healing, reducing the effects of chronic stress, versus using it as a dissociative agent, which sometimes that can be very helpful. Sometimes that's what people need, is a little dissociation. So I'm not knocking that as a terrible thing, but it's all about a balance and kind of conscious consumption, as opposed to dissociation. So I don't know why I started on that path, but that's kind of my thoughts about, how cannabis sometimes plays into this as something that can be helpful.
For instance, when Sarah said about the gut, it's some people under significant stress can't eat. We've all been there, where it's like, and cannabis can be a wonderful solvent to that, where you can at least experience a little bit of a decrease of that clenching feeling in your stomach, that something terrible is about to happen, is happening, is full of worry, and feel a little bit relief so that you can take better care of yourself in that moment.
Right. And I think it's a great tool for so many things, because it works on so many different parts of the brain and the body. Many symptoms related to chronic stress can be alleviated, or you can support your nervous system with cannabis is one way. So we do treat a lot of patients, and often we do start with, when we're doing our eval, with that adverse childhood experiences assessment, which I know that's something that we kind of wanted to talk about. You've touched on a little bit. I don't know if you've ever
Sarah wants
taken it, Sarah.
Have any anything to add about that?
Sure. I'm in the chat
Awesome.
a little bit, and really liking that example of healing a broken bone. And I think just to add on to what you were saying, cannabis has there's so many varieties of cannabis, and also beautiful combinations of cannabis with other herbs and things like that, if you're thinking about cannabis as one of your tools. And depending on dosage and product type and use, it can be really used to kind of tune in or tune out. That's what I put in the chat. But I was just thinking about how cannabis can be helpful for tuning into the body as well. So sometimes we benefit from a kind of like a gateway. And one of the things that I did want to share today is that this is kind of a big thought, but that I haven't fully explored yet. So hopefully, hopefully this is somewhat relevant. Thank you. That trauma is really a gateway for healing. Maybe we come into the world with trauma, whether that's birth trauma or the trauma of everyday life. And so while our experiences of trauma, our responses to trauma, our trauma responses can be incredibly debilitating and sometimes life-threatening, they can also really call up for us a deep need to engage in our own care and well-being in a different way. And that's something that that practice of awareness and taking care is something that we have the responsibility, maybe even burden to do for the duration of our lives. So it's a really big, it can be a really big eye opener, to just use some simple terms there. And this is a separate thought, but something I wanted to talk about a little bit or just mention is disabilities and the ways that our bodies maybe change in response to trauma, or the ways that our bodies are different, and how sometimes the inaccessibility can also be very stressful. And there are, as Beth mentioned, a lot of experiences, medical experiences, poverty, environmental toxicity, different things that can really affect us. And so this can be a very focused lens, or it can also be a zoomed out lens. And depending on where we are in our healing journey, whether we're just beginning or maybe some years into it, we may want to tune in and tune out in different ways. And that there are different tools that may be relevant for us in different seasons of our healing. And so just like the chronic and the touch, I also want to bring in medication, and that medication can often be a really helpful crutch. So just a little self-disclosure here. I'm somebody who lives with a PTSD diagnosis. My experience of PTSD has really evolved over the years, and I have engaged with a lot of different healing modalities, and sometimes that crutch can be life-saving. It can be the thing that we need to be able to bring us into some more nuanced and holistic approaches to our care. And so as we talk about shame and destigmatization, I also want to say that sometimes hospitalization is part of the healing journey. Sometimes we're coping and then things kind of crack wide open for us. So this, just like identity is not a monolith, healing is not a monolith, trauma is not a monolith, and our journey is not linear per se. So I think I'll pause there.
Well, I love that sentiment. I think that that's really important to remember. You know, it's healing is not pretty. always. And it's true. And, you know, I mean, it's what we see about healing on Instagram, while there's some good resources out there, it's healing can be a very ugly process sometimes, but I mean that in a good way, you know, really raw. And so whatever that looks like for you right now, you know, I think we're all here on earth on a healing journey. And, you know, I appreciate your self-disclosure. I share the diagnosis of PTSD. I myself have, you know, tried many things too. I one of the most amazing healing tools that I've experienced was a form of therapy called EMDR, eye movement desensitization and reintegration.
Thank you.
I believe
Something I should absolutely
something like
know
that.
what it means.
And it involves kind of re-experiencing of a trauma. So I was dealing with grief at the time when I did this, and bilateral stimulation of the brain while you're doing that. You know, I went into actually on the advice of Beth at a time when I was looking for something to help me when I was having a strong re-experiencing of some negative emotions that I wanted to deal with. And this, within a few sessions, to be fully honest, had really helped me with the experiencing physical sensations of fear, trauma, something that was interfering with my life in a pretty significant way. And I have to highly recommend EMDR as an option. And there's a lot of practitioners out there if you just Google that. But if you're someone that's has that sort of a, you know, re-experiencing of, you know, a traumatic situation in your life, it's something to think about.
Please
That's really
connect
helped
with
me.
us if
Yeah.
you're interested in that. It's a specific training. I know a lot of great therapists. I'm not trained in it. I hope one day in my training junkie behaviors, it's on the list, but that there's a very good resource for those specific trainings.
So yeah, that's another
I'm
thing
sorry, for
that's
those
been
specific
great.
therapists.
Yeah.
And that's go ahead, Sarah.
Oh, no, please finish your thought and then I'll jump in.
I was just going to say that you know, from a therapist point of view, there really are seasons in your life that different types of therapy, different therapists, different modalities, different types of healing, somatic therapies, working with coaches. There are so many different types that are going to fit you at different times. I just got something from the Juniper Center, which is local here in Park Ridge, with a practitioner who specializes in cancer. You've gotten a cancer diagnosis and just coaching you through the whole process. There's just a lot of really fantastic. And I think that one thing I always tell my clients when I start is the one thing we know about therapy is you have to feel that your therapist, practitioner, whoever the person is a good fit for you. You feel comfortable, you feel safe. This is what we know. The relationship of therapy, it is what we think is the greatest source of healing and why it is helpful. So there's many modalities, and that can be a big bonus, but finding the therapist that you truly connect with and you are understanding and you feel like is understanding and mirroring you and provides a little bit of that reparative relational experience is key. You know, if you're looking for a therapist, it's great if they give a free consultation and chat on the phone beforehand. I would worry if they wouldn't chat with you for at least 5 minutes, and just kind of like make sure you find someone who's a good fit. Go ahead.
And perhaps that could even be you, Beth. She's taking clients here. And I think that's something that, you know, same thing goes for me. If you've got PTSD or another mental health diagnosis and you are thinking about using cannabis, or you do currently use cannabis, highly recommend you make an appointment with a cannabis clinician to help you optimize that treatment. There are a lot of great products and ways out there that you could use cannabis medicine to help with this. I think there's some ways that could go wrong. So
And if you're dealing with chronic illnesses, medical drug interactions, that you're very good at parsing out for folks and things like that.
Yes, if you're someone that has multiple diagnoses, you have a long medication list. That's one of the things I specialize in doing, is just giving that a good look, making sure there's no interactions with cannabis potentially, and, helping you get nailed in on a dose that's going to be helpful, that fits in with the rest of your treatment. So that's basically what I do. And Sarah, your services as well, I think, could be really helpful for somebody that's recovering from chronic stress and trauma.
Thank you. Yeah, we can all be resources for any of you or anyone that you know, if you're interested, and maybe at different times. So maybe at some point you're working with a therapist, or maybe you're starting off with a cannabis clinician, and then maybe you're moving into some work with a health coach when what you're experiencing isn't so acute. And there are a couple things that I wanted to share before maybe we move into closing out, since I know we're about at the top of the hour and we want to be respectful of everybody's time. I think a big part of healing work, and healing is kind of a funny term because it almost implies like arriving at a destination of being healed. So I just want to really put the healing journey in context. What was I going to say about that? Oh, yeah, that a lot of it is about really being able to experience safety in your own body and in your own mind. We really have limited control over our external environments. And so the resources that the three of us provide are really to support you in your personal and internal well-being, so that you have the grounding and resources to be able to cope with everyday life in a way that maybe starts to feel more optimal and moving from surviving to thriving. I also want to uplift energy work and body work. We don't have any, I think we all do a little bit of energy work, but I don't think any of us on the call are hands-on body workers. So, sometimes we want to start with talking, sometimes we want to start with soothing the body, and that can be a spiral or a continuum. And another little tidbit that I was thinking of, kind of linking our cannabis or herbal use or psychedelic use, is that with the healing journey, one might even really benefit from a kind of microdosing approach. So one day on, a couple days off. It's not always the time to do immersive work. And sometimes it's really great to take a step away. And nutrition and other herbs can also really be complementary if maybe you're feeling a little talked out or not quite ready to talk. I love what Beth said about the relationship between the therapist, that you're really doing it together. And there's a reciprocity exchange there happening in some ways too. Not that the therapist needs anything from you, but that alignment. I think to just uplift one thing about coaching and my coaching practice, I think it can really support developing and integrating self-care behaviors, activities, and practices, which can often be a struggle in response to a body response to trauma. So that can be available for you. And unless we have any other closing words or comments, I'll guide us out with a little bit of grounding so that we can transition from this space feeling able to move on to the next thing in our day. So I'll pass the word before I lead us through anything else.
I just think that's great. I think self-care is the kind of treatment for chronic stress and trauma. That's how we heal ourselves. So I love that. Thank you, Sarah.
Thank you.
Yeah, you're so welcome. And so we'll just do a little momentary thing. I'm not actually sure what it's going to be yet. And then I'd like to suggest that we're going to put up our bio slides if we have them, just so that people have our contact information And I'll just shout out.
Put those in, sorry.
Oh, that's okay. That's no problem. Well, you can
we'll
reach
add it.
me. Yep, you can reach me through my practice, Sarah Rose Botanicals, and you can reach Beth and Katie through Modern Compassionate Care. You'll have access to our contact information in closing. And so the theme that I have for us closing out is compassion. So I'll just be a little spontaneous here and say that I invite each and every one of you, myself included, to maybe call in a feeling, a sense, an image of compassion, maybe even doing something for yourself that feels compassionate. That might be like, flicking out your hands, or, if your hands feel a little cold or sweaty, doing something like that just to ease. Maybe shimmying out your shoulders a little bit. And I'd like for everyone here to really take a compassionate moment and to express gratitude for ourselves for being here today in this opportunity to learn together and be in dialogue. And let's just take 3 closing breaths at our own pace. And we'll close out at 1:05 CST. So at your own time, breathing in, maybe breathing in through the nose and out through the mouth. You can keep your eyes closed or open. Just calling in some awareness that we are here, breathing, a moment to be present with our breath. When you're ready to, you can let that go. And if you feel like unmuting yourself to say goodbye, you're welcome to. Thank you all for being here today and for showing up for yourselves and for your loved ones in this way.
Thank you, everybody. And we'll be back our regular time last Thursday of the month in January. So our next one of these will be January 26th. We're going to keep on our theme of trauma. We're going to be talking a little bit about trauma within the medical system, self-advocacy, and we're going to have a guest, our friend, Donna Murray, who's an amazing advocate. And she's going to share with us some of her experience. We're going to talk about, medical trauma, self-advocacy, maybe a little bit of long COVID. And
we know how to have a good time.
So if you guys have any questions or comments that you want to, add to us, ask us before the next event, just please shoot us a DM, shoot us an email. We'd love to make this interactive.
Want to talk about, if you want to come on and join us, absolutely.
Yeah,
really fun.
Thank you, everyone.
Yes, and also Katie, correct me here, but I know that Beth and I both offer a free consult to see if we're aligned to work together. I'm not sure if that's part of the cannabis offering.
Definitely,
Katie,
yeah. I usually will, talk with someone. Just give me a call. If you have a question and you're not sure if you want to make an appointment, just give me a call. I'm happy to answer any questions, allay any fears. If you, just want a little bit of information, you don't have to make an appointment. Just give me a ring.
Explain the different services that you offer.
Exactly.
It's not always clear to people who haven't worked with a cannabis clinician before.
Totally. So definitely reach out. I always will meet with someone ahead of time to just give them, a rundown, answer any questions.
Okay.
All right. Thank you, everyone. We'll see you next time, and happy holidays to all of you.